Hi, my name is Nancy, and I would like to welcome everyone to our live talk for Maternal Mental Health Day. And what I'd like to say is today we are celebrating Maternal Mental Health Day, and we're also raising awareness of perinatal mood and anxiety disorders with the hope that this will lead to increased services and more funding for the services that already exist. So in the spirit of Maternal Mental Health Day, I'm just going to share a picture of my family. So this is myself and my twin girls who are now 14 and my son who is 17. So I wanted to let you know that it's estimated that between 15 and 21% of pregnant women will experience moderate to severe symptoms of depression and anxiety. And we want women to know, or women with perinatal mood and anxiety disorders or anxiety and depression, that they're not alone and good mothers can become depressed and have anxiety. So I also wanted to introduce you to what this project is and how this presentation was brought to you. So there's a collaboration between Women's Mental Health at the Royal and the Ottawa Birth and Wellness Centre. And part of this collaboration is a needs assessment where we're looking at the mental health needs of women at the Ottawa Birth and Wellness Centre. And we're also providing education to pregnant people, moms, and their partners. And we will also be giving information to the midwives themselves. So Anne-Marie, would you like to introduce yourself?
Sure. I'm Anne-Marie O'Brien, and I am a social worker in women's mental health at the Royal. So I'm really happy to have this chance to talk to you today, to talk about what women's mental health at the Royal involves and how you can get involved with that. And yeah, so I'll pass it over to my colleague, Emma.
Hi there. So I'm also a social worker at the Royal, and I've been working in women's mental health for about a year. Oh no, more than that. I guess almost 2 years. So prior to that, I was with the psychiatric outreach team, working primarily with homeless folks, still at the Royal. And so I'm currently that. I'm a social worker. I do focus on women's mental health and primarily mostly on the VAW sector, so the prevention of violence against women or the addressing of survivors, like working with survivors of violence against women. But also I'm a student of plants, so that will factor into our presentation today as well.
Great, thanks, Emma. My name is Nancy. As I mentioned before, I'm a social worker by trade. However, I was hired by the Royal in January as a mental health worker and peer specialist. And what that means is that I've had lived experience with mood and anxiety disorder after the birth of each one of my children. So after the birth of my son, and then after the birth of my twin daughters. And I'll just take the picture down so you can put up your presentation, Anne-Marie.
All right, then. I will put up my presentation. And here we go. Okay. Share screen. Okay, there we go. I tell you, I feel like a genius every time that works out. I feel like the Wizard of Oz. Okay, so in honor of Maternal Mental Health Day, we're going to talk about mental health and well-being in the time of COVID. So women's mental health at the Royal takes on a feminist approach. And our approach is that every woman is the expert on herself. And we make space for the women's voice within everything that we do. So we love this World Health Organization definition of mental health as being a state of well-being in which each individual realizes his or her own abilities, can cope with the normal stresses of life, and can work productively and fruitfully, and is able to make a contribution to his or her own community. And what I want you to notice about this definition is how subjective it is and how personal it is. each of us has our own ability to cope, ability to contribute, and to work productively, either paid or unpaid. The other part of this definition that's important is the action part. It's just not all about knowing, it's also about doing. And in my experience in women's mental health, often it's not that we don't know, we just get stumbled up in transferring that knowing to the doing part. So we're going to provide a little bit opportunity later on in the hour for some practice. In contrast to the subjectivity of mental wellness and the personalness of mental wellness is mental disorder. And mental disorders are very, very specific. And I'll just invite my colleague Nancy to talk a little bit more about that.
Sure. So I just want to acknowledge that during the time of COVID-19, many pregnant people and moms are nervous, and a certain amount of anxiety is normal and to be expected with the large shift that our lives have taken. And also acknowledging that with the birth of a baby, your life changes in many ways. Your relationships are going to change, your roles are going to change, how you spend the day is even going to change. You might have previously been going to work all day, and now you're partially or fully taking care of a baby. So when we look at the umbrella, so the umbrella is representing perinatal mood and anxiety disorders. So under that umbrella, there is depression, anxiety, bipolar disorder, post-traumatic stress disorder, psychosis, and obsessive compulsive disorder. So I think a lot of people are used to hearing about depression when you're hearing postpartum, but there's actually an umbrella of diagnosis, and it can actually start to happen before you've given birth, so prenatally, and the onset can also be postnatally. I also want you to know that after the birth of a baby, many women feel weepy and anxious, and this is normal and called the baby blues. The baby blues will go away with rest, nutrition, support, and time, and they usually only last for 1 to 2 weeks. So I'm going to read some symptoms, and if you notice that your lowered mood is lasting over the 2 weeks, or your anxiety is increasing over the 2 weeks, then it might be time to seek professional assistance. So some of the symptoms include sadness, anger, exhaustion, feeling out of control or overwhelmed, difficulty sleeping or eating, and fears and scary thoughts that don't go away. So that's not an exhaustive list. There's actually quite a lot of symptoms that you can be experiencing. So as I said before, if you're experiencing any of those for a prolonged period of time and it's making you uncomfortable, I encourage you to seek professional medical assistance or support. I also wanted to mention that some women have a diagnosis of mental illness before pregnancy and birth. And for those, it's important to talk to your healthcare provider and to let them know that you're thinking about becoming pregnant. And this is especially if you're taking medication. It's also important to monitor your symptoms for change. And remember that there's lots of people with mental illness who are great parents.
Thanks, Nancy. As we're talking about the need for treatment, I will just make everyone aware that we have at the Royal something called C-Prompt. And this is a service that was developed and offered during this time of COVID for a rapid response to people for an assessment. You will need a physician's referral for the C-Prompt clinic. However, you will be seen virtually and in a timely manner. It is not an emergency service, but it is meant to address emerging problems. And please look to our website and avail yourself of that service should it be needed. So from that, I'm going to talk about resilience. Resilience is something that we often don't know we have until we're in it. And as Eleanor Roosevelt very wisely said, a woman is like a tea bag. You never know how strong she is until she gets in hot water. And I think if you reflect on your life, you will realize, wow, I didn't know I had it in me. And many, many women during the time of childbirth, this is their experience. And when you look at the changes that your body goes through during the 9 months of gestation and supporting this other being developing within us, and you think of how your body changes to support that, and you think of your body during delivery and labor, and then you think of your body after and how it goes back to the same old, working sometimes better than it did before. And it really is miraculous when we focus on what our body is capable of during the time of pregnancy, and our mind as well. And so when we are faced with stress, as we are during the time of COVID, many of us are remarking on how we have adapted. We've adapted to being at home. We've adapted to working remotely. We've adapted to finding connections, to being together and being apart at the same time. And many of us will realize that we actually have a level of resilience that we were unaware of. Now, there's many factors that are going to influence our level of resilience, and these biological, psychological, and social factors, they also impact experiences of treatment, experiences of illness, experiences of recovery, and experiences of resilience. And this is when we go back to that individual subjectiveness. Each of us has strengths and weaknesses within these spheres, and you think of them of your own, and you think of your strengths and weaknesses within each of these spheres. And you also think about the process of adapting to a new role, your new role as mother, as parent of a little precious being, and how each of those factors contribute to how you are adapting to this new role. And as we continue in our presentation, I'm going to be referring back to our holistic self, our biological, psychological, social, and we could add to that spiritual self as well. When it comes to women, there is no shortage of self-help advice, no shortage of friendly, meaning well advice, right? Everybody seems to have an opinion on how you can be better. And when very well-meaning others are in your life giving you helpful hints, it can have the reverse effect of giving the impression that somehow you're not good enough all by yourself. So when we notice all of these helpful hints in self-help, the most important thing is that we own it, that we're the driver between what we want help with and what, no, we're good, we've got this, or just give me some time, I'm sure I can figure it out. So at the time of pregnancy and having a new one, you will find no shortage of advice. And what your task is to own what you need help with and what you don't need help with. So again, being aware of yourself, cultivating self-awareness, making space for reflection on what am I good at, what do I need help with. And this is going to take some time, because when you're new in a role, you don't often know what it is exactly you need help with. So our very general piece of guidance is to know yourself. And that's where the wisdom is going to come from. And that is my next slide. According to Aristotle, which is very lofty for a Wednesday afternoon, But knowing yourself is the beginning of all wisdom. And you're going to get to know yourself as you approach motherhood and then, launch yourself into that journey of discovery. You're going to be finding out yourself in a whole different way. Yourself as a mother, yourself as a parent. So knowing yourself is the work, and making space for reflection, for acknowledgement, for what is my true self and what do I need to promote my true self? What am I good at? What do I want to work on? And really knowing that that will change, and knowing that you're the driver of all of that. So we have a little bit of a practice exercise for you here, just to get you started on the knowing yourself journey. So this is the task. When you reflect on not your best self, and believe me, in the motherhood journey ahead, there are going to be lots of days when nobody's winning Mother of the Year award. It's hard, it's challenging. The little ones are going to press our buttons. So you're going to have days when you're not your best self. And even now, there are going to be days that you reflect on where you're not your best self. So in those moments, or maybe after that, with love and kindness and without judgment, recall the time when you weren't your best self. And list the adjectives to describe how this looked like, what this looked like, and how this felt when you were not your best self. What were you like? It's unpleasant to remember this, but from knowledge, we can change, right? We can't change what we don't see. So when you think of that, often people come up with adjectives like impatient, judgmental, short-tempered, angry. You get the idea, okay? And you just kind of make note of that for the moment. And then we go on to the next part, which is your best self. This is a good day. This is when things are working for you. And you acknowledge with love and kindness and without judgment, a time when you were your best self. And what are those adjectives like? What did it look like and what did it feel like in your body when you were your best self? And people come up with adjectives like kind, forgiving, knowledgeable, charitable, happy. And just notice that. So we've got two sides of yourself, not your best self and your best self. And most of us spend a lot of time in between those two options. So we have a little exercise for you to help you be your best self more of the time. And this really requires attending to the different phases of self. Remember that diagram of biology, social, psychological self? Well, this is another version of that, which is labeled physical well-being, psychological well-being, social well-being, spiritual well-being. And when we think of self-care, how important it is to fill in each of those boxes, to take care of each of those parts of ourselves. Now, many of us, when we do this, might notice that we have a go-to area. We are great at physical well-being. We eat well, we exercise, and that's awesome. But what are you doing for your psychological well-being? Now, there's going to be overlap. There's lots of good evidence that the more you take care of yourself physically will have spillover effects. And that's going to be the same for whichever sphere you started. You will have spillover effects. But it's also important to attend to each one. So psychological self, this can include things like brain activity. What are you doing for your brain? And this may include things like reading, puzzles, learning a new language. Not going to be doing that with a new baby. However, you are going to be reading a lot, educating yourself, knowing what it is you need to know to be the best mother you want to be. Your social well-being. Are you connecting with friends via Facebook, limited, Zoom? other platforms, checking in by the phone, a simple text with supporters, with people that have your back, are good and kind. Your spiritual well-being. What are you doing to connect yourself to a spiritual community, if that's something that has been part of your past or something that you value or you have received comfort from? Including our spiritual selves, many include in that category nature, connecting with nature, the larger world. And with that, I'm going to pass it over to my colleague, Emma, who is the plant lady and also has a knowledge of how nature can feed our souls and our brains and our physical self. So I will pass it over to Emma.
Thank you. Yeah, so I'm wondering if we could, is there a way that we could get it on presenter mode? Just because some of my images might be kind of small otherwise.
Okay, presenter mode. Now,
the little screen at the bottom there toward the
oh,
bottom.
I get it, Emma. Right. Okay, perfect. There you go.
Lovely, thank you. Yes, so I wanted to talk a little bit about, well, just to build off the thing on self-care. So sometimes the thing about self-care is that it's a bit too much focused on the self. When we know that we're like a person who lives in a context, right? And that context can shift, right? And that sometimes we intentionally shift it for our own well-being. And that can mean shifting relationships and things like that. But I think we've all had that experience probably where, you know, you're at home and you don't feel so hot. And then you go outside and you're like, oh, okay, you come back and you feel a lot better. You feel like your whole mindset has been shifted. Maybe you feel physically better, but it can really shift things. And I just wanted to before I get into Shinrinyoku, and I'll talk more about that, just talk about how in this society, we tend to see ourselves as distinct from nature, like humanity. Not only do we tend to individualize ourselves in a kind of extreme way, but we also we separate humanity away from nature. Like nature and culture are these separate things. And we tend to really like to separate stuff out. But I think that our contexts ideally should nourish us physically, spiritually, psychologically, and socially, and that those things ideally would be interwoven, right? And that our environments are us. Like if we have a healthy environment, ideally we have boundaries that are fluid enough that we kind of have this fluid exchange with our environment, right? So this isn't ideal, this isn't possible all of the time. And obviously we all go through different things and have to shift through time, but this is sort of the ideal, right? So why talk about nature now as we talk about mental health and maternal wellness in times of COVID? I think it's a good time to bring it up, not only because it's spring and we're in confinement and one of the few things we can do is go outside, but also because it's a good opportunity maybe to build relationships with the natural world. I think that relationships with plants, with animals, with other living beings can be social relationships. So they're not only things that we have with other humans, like we too are animals. And it's just useful to remember that we're part of a whole family of things, really, right? And so I think that immersion in the natural world can bring us some kind of solace, especially as we're going through difficulties. We're going through a global difficulty together collectively, but also maybe as we face our own individual difficulties, right? Or maybe life cycle difficulties like around birth and whatnot, right? So, and like what better time to kind of represent that than spring, right? So witnessing the fortitude of the natural birth of the natural world, which is sort of reborn, like being reborn now. All these plants are kind of emerging, right? Okay, so how to do this? How do we foster a better relationship maybe with the natural world? Well, one way to do that is Shinrin-yoku. So what is that? You might have heard of forest bathing. So that's That's sort of the English translation of Shinrinyoku. Shinrin literally means forest and yoku means shower. So, you know, bathe, bath, shower. But we're not actually having a bath in the forest, although that also sounds nice and I'm not opposed. What forest bathing is it's more of a sensory immersion. So we're immersing our senses in the forest and in the natural world. There's a lot of focus sort of on the color green, right? So seeing the color green has a big impact. So when you're in a forest and you see the whole forest canopy, you're seeing a lot of green. Maybe not as much right now, but in the next couple of weeks, we'll be seeing more. And the smell also. So a lot of plants emit volatile oils, which are essentially essential oils. So that whole olfactory component, right? That we're smelling all of these plant oils that have an impact on us, right? And an impact on our well-being. So these are the two main, like smell and sight, but also sound. So the sounds of the forest, I think we all know that sort of the sounds of birds and trickling water and wind in the leaves. Like if you buy sort of like a tape recording that's supposed to be relaxing, these are usually the sounds that are on it, or the ocean, right? But then also touch. So usually when you're doing Shinrin-yoku, you might touch some tree bark, touch various plants, stones, and that really that's part of this whole body experience, that you're using as many of your senses as possible to sort of experience that moment of being a part of the forest. So Shinrin-yoku was developed in the 1980s in Japan. There's a history, but there's a much longer history in Japan of forest worship. So that's part of their Buddhist tradition as well as their Shinto traditions. And if you go to Japan, even in Tokyo, they have like forest shrines in the city. So it's a really central part of their life there. And so all of this is interesting and nice, but why would we talk about this now? So maybe we can flip the slide if that's okay, Anne-Marie.
Okay. Oops, did I flip too much?
No, just one back, yeah. Thank you. So yeah, so why Shinrin-yoku? So research has indicated that it's great for your health. So all of these things, this whole sensory immersion can really support your immune function, can decrease your risk of cancer, decrease blood pressure and risk of heart disease, increase your metabolism, and reduce feelings of anger, confusion, anxiety, and depression. And it can do that for up to a month, which is pretty interesting. And so we know that like just one day a month in the forest can have an impact for those next 30 days of decreasing those things, right? So research has indicated that. But so, and all of these things, it's just useful to take note of, are like useful in any moment of distress, but probably especially now, right, as we face COVID-19. So a good thing to keep note of. And we can move on to the next slide if that's possible. So that's great. Like that worked in Japan. What exactly were they doing? Like what were these folks doing when they were in the forest? So typically what folks would do in King Lee's study, so King Lee is the main researcher who has sort of developed this notion of Shinrin-yoku. People will go for about a 4-hour-long walk, but they'll only walk about 5 kilometers. So that's pretty slow. Like usually the average person will walk 5 kilometers in an hour. So you're going about 4 times slower. And while you're doing that, you kind of take time to breathe in the smells of the forest, to look at your surroundings, especially all the green things, right? So to really take note. And it's interesting, plant biologists have actually talked about and published on this notion of plant blindness, right? So that in this culture, for instance, we look at green stuff and we just see green, but we don't necessarily see individual plants or distinct and separate plants within that. So we'll kind of get into that more. But the usefulness of seeing and resting your eyes on something green, right? And how beneficial that can be. On, again, listening to birds, rustling leaves, babbling brooks, touching trees and other plants, and then breathing deeply and slowly. And people would also take regular breaks to relax, do Tai Chi, eat, and drink water. So that sounds lovely. And I wish we could all do that, but we probably can't, right? Right now, a lot of people don't have cars. right? Or even if you do have a car, you're not even really supposed to necessarily drive out of the city, right? We're not even supposed to go to Quebec. We can't go to Gatineau Park. So what do we do? Well, I think that we can do Shinrinyoku in the city, right? And it's interesting because King Lee's research talks about how you get more benefits when you're in the forest and there's a full forest cover, a full canopy. And so the more canopy, the more benefits you get. But he talks about how being in a park in the city is still very beneficial. And I think that like even in a humble patch of weeds, you can find a miniature forest, right? So this is a painting by Albrecht Dürer, and it's called Study of Weeds. And I like it because just looking at this simple image, there's about, I think about 5 plant species. I can pick out 5 or 6 maybe. So even in a small patch of weeds, which this man obviously took the time to lovingly illustrate, right, and to draw out very painstakingly and carefully, like this in and of itself seems almost like an exercise of Shinrin-yoku to me. He's sort of representing the diversity of these little patches that we might just ignore as green, right? So it's about sort of like trying to find that sense of wonder in this, which again is sort of, it's a childlike sense of wonder. So if you have like small toddlers who are still, everything is new and they're learning about stuff and they're close to the ground, it's a great way to sort of like try to see things from their point of view, right? So even a humble lawn might serve as an excellent forest for us if we want to practice Shinrin-yoku. So how might we do that? I think that, so this is I've sort of taken what King Lee did in his studies and I've sort of reformulated it. So how we might do Shinrin or practice Shinrin-yoku in the city. So again, we would go for maybe a slow walk in a green space. A forest might be ideal. And we're lucky that we're in Ottawa. There are many patches of forests that sort of are interlaced through the city. But like I said, even lawns can hold beautiful surprises, right? And so we might scan and look at our surroundings and check what colors and forms we see if they've changed from the day before. So if we're doing the same walk all the time, it's interesting to take note of what's changing. We might take a moment to smell a dandelion, a violet, a tree like a white pine tree or some other flower, right? And we might listen, like, are we hearing birds? Do we hear running water? Are we near the river? Is it quiet? What's going on, right? And just taking note of that. Maybe picking a dandelion or taking time to touch some tree bark and asking ourselves what it feels like. And being aware of that, right? Being aware of our hands as like sensory entities, right? And remembering to go slowly, to breathe deeply, and to kind of get creative and improvise. So King Lee talks about doing Tai Chi in the forest. Maybe Tai Chi isn't our thing. That's okay. Maybe you like drawing. Maybe you like to do yoga. Maybe, I don't know, like there's a lot of room here for you to do what works for you, right? So that's kind of my thing. I have a few plants I just wanted to show you that are going to be emerging this month. So if you do have small children or you're going for walks in the neighborhood, these might be fun things to kind of keep an eye out for, like a bit of a treasure hunt or something to that effect. So this plant here is, it has a lot of different names. It's called ground ivy, or sometimes creeping Charlie or henbit. So this is a common weed. If you look it up, you'll often see that most of the articles on the internet are about trying to get it out of your lawn. But it smells wonderful. So give it a sniff and you'll see all these lovely, tiny little purple flowers. So excellent for toddlers to find in some grass. And the next one is violet. So violet is all around Ottawa. You'll see it in different parks. It also tends to grow in sort of damp but open and sunny lawns. And maybe a little bit less common, but you'll still be able to find it, and they'll be emerging this month as well. And then the next one is dandelion, so one that you're probably all familiar with. But how often do we actually take the time to appreciate a dandelion, right? Like when was the last time we smelled a dandelion? Do we know what it smells like? So just taking a minute with a dandelion, I think, is a useful exercise if we feel up to it. And then last but not least, we have apple blossoms. So these will be coming out this month as well. And these are not lawn dwellers as much, but live higher up in trees. But a fun thing to spot in your neighborhood too, and to look forward to. And just a reminder that, like, yes, it's May, and we know that May is like, you know, April showers bring May flowers. So we anticipate them. But every month of the year, like all the time, there's stuff there for us to bear witness to, right? So to know that all through the summer and the fall and even in the winter, there's evergreen trees, right? So these things are always there for us to spend time with, and I think can offer us solace as well. So a thing to experiment with, and I hope that you have fun with that.
Wow. Thank you so much, Emma. Wow, it was lovely listening to you and giving your brain something else to focus on with the beautiful pictures and, you know, just anticipating the beauty that's to come, right? And if you're not feeling 100% and not feeling your best self, to get out and get for a walk and just notice the world around you. It can help enormously. So that is our presentation for the formal part of our presentation on Maternal Mental Wellness Day. And we're certainly happy to take any questions that you might have or that might have arisen from something that you've heard today that you're interested in.
We do have a request if we could share the self-care slide once this is all over and done with.
Oh, absolutely. Happy to share it. We can have that on our Facebook at the Royal and your Facebook at the Birth and Wellness Center.
I guess we could probably, maybe because it's a PDF. We'll probably be able to like a Google link.
That'd be excellent.
Mm-hmm.
Perfect.
But for now, there isn't any actual questions.
So Stephanie,
Yeah.
I also wanted to mention, I don't know if I mentioned this earlier in our talk, but Dr. Giroux, who is a perinatal psychiatrist at Montfort, has done a talk on perinatal mental health, and that's available on the Ottawa Birth and Wellness Facebook page. As well, there's a Facebook talk with two midwives who are talking about birth, pregnancy, breastfeeding, postpartum in COVID-19. And then next week, we have Dr. Gandhi, who is going to be talking about supports for people with postpartum depression or postpartum anxiety or perinatal anxiety or postpartum depression. So she's going to be talking about psychotherapy and possible medication. And I also wanted people to know that we've created a list of resources that is also available for people to access. So some of those resources are specific to COVID-19, and other resources are supporting mental health in general. And that will be available on the Ottawa Birth and Wellness Center's website.
We can also add that that link for those resources at the bottom of the of this Facebook Live. So far, still no questions.
Okay, perfect. I think that was a great, that gave us some great information. And Stephanie, what have we done in the past for questions that have come up post discussion?
You have answered them in the past, or we haven't seen many questions come up post Facebook Live, but they are definitely addressed, and they're directed to the right person, or they're just answered right away, depending on the question.
Okay, perfect. So I can monitor that, and anything that I can't answer, I'll direct to Emma or Anne-Marie.
Sounds good.
Okay, and I realize I just forgot to mention too that there's a small PDF. It's just 2 pages on Shinrinyoku, and just with those plants that I discussed a little bit, if anybody wants to use them to try to like find them in their community, that will be posted as well.
Perfect. Thank you, Emma. All right. If that is all, then we'll end the session now.
Thank
Thank you,
you.
Stephanie.
Say thank you,
Thank
Emma.
you.
Thank you, Anne Marie.
Bye.
Bye.
Bye.